All right, well, joining us now is Dr. Bankole Johnson to break this down even further. There are worrying reports, as you can see, coming from the United States that this Delta variant is spreading like wildfire. What is the situation with COVID-19 in the United States? How dire is this?
Well, thank you for having me on your show. The situation is pretty poor. As you know, cases are rising. There has been close to about a 400% rise in numbers over the last week alone. And the number of individuals who are not vaccinated doesn't seem to be changing terribly much as a percentage of the entire population. So what we're having most of the people who are hospitalized being individuals who are unvaccinated from COVID.
How are authorities dealing with people who are unwilling to get vaccinated? I mean, what kind of steps are we seeing taken by authorities to try and combat that issue?
I think there have been mixed messages, and I have sifted through some of them. To be honest, I'm not quite sure what a strong recommendation is, rather than to simply say it is recommended that you keep your mask on inside. We need to have stricter and clearer mandates such that individuals are going to be able to adhere to them without ambiguity. And as you know, it's not only the fourth wave of COVID that we're dealing with. There is a whole plethora of secondary effects and secondary pandemics like alcohol abuse, drug abuse, suicidal behavior, mood disorders that are probably just on the horizon for us to be another huge health crisis.
Right. And we're also seeing an issue, which is that hospitals that are being overwhelmed by these coronavirus cases are also unable to provide that same amount of service to people dealing with other health issues, which I imagine as a doctor yourself, you've experienced this firsthand. You know, just today we heard from New York Mayor de Blasio that only vaccinated people will be allowed to enter restaurants and fitness centers, kind of a green pass system that's similar to what we have here in Israel. As a medical professional, what is your take on that? Is that what we need to see rolled out across the country?
I think that it's one way of trying to tackle the high amount of people who do not want to get vaccinated. But at the same time, we don't want to create an apartheid country in which there are individuals who are vaccinated who are treated very differently from people who are not. So this is a very complex issue. I think what the best solution is for everybody to continue to wear their masks and to be cautious if they are close to other people. The pandemic is unfortunately not over for most of us, and therefore we need to take clear precautions.
Now, when we hear Dr. Fauci say that the worst is yet to come, what does he mean? What should we be expecting?
Well, what he means is that we may get back to seeing the hospitalization rates, the death rates from COVID that we had before in the last summer. We're going to see a rise in other pandemics in the United States. As you know, alcohol drinking and alcohol use disorder has increased about 25 to 33%. We will have increases in overdoses. We'll have increases in mood disorders and other psychological problems. And to be honest, a lot of people at home are just getting tired of being at home and have lost all their enthusiasm. So what I think Dr. Fauci is trying to reply to is to say the worst is still to come. At the beginning, we were fighting one virus, and now we're fighting a variant of that virus, plethora of other health conditions.
All right, well, I'd like to thank you so much, Dr. Bankole Johnson, for joining us with that breakdown. We're out for a short